Did you know that pregnant women are more exposed and more sensitive to different health issues? And some of these can be very serious and even life-threatening. I'm Dr. Carolina Melgar from Sono Health. I'm a practicing cardiologist focused on fetal cardiovascular health. And today I want to dive into this interesting topic. Let's discover the most frequent health problems that mothers go through during this magical journey of pregnancy. Imagine pregnancy like a physiologic stress test for a woman's heart and circulatory system. It's not only dangerous approaching the birth, but it can also cause serious long-term complications. Even healthy patients can experience heart problems during pregnancy. Now, during a pregnancy, a woman's blood volume typically increases up to 50%. This is to provide nourishment for the growing fetus. However, as blood volume increases, so does the amount of work the heart has to do. A pregnant woman's heart has to work twice as hard to pump that extra blood into her body. During labor and delivery, her blood pressure and heart rate can drastically change, putting additional strain on the heart muscle. After the delivery, the heart muscle can be stressed because of the extra volume that was in the placenta that now returns to circulation. So basically, women with pre-existing heart conditions can experience worsening of their symptoms at any time during pregnancy, labor, delivery, and postpartum. In this video, I'm not going to go into details about how pregnancy affects cardiovascular health. I want you to know more about this, so check out my video on cardiac disease during pregnancy. So stay with me and let's dive into all those common health problems during pregnancy. Number 1, constipation. The hormone changes in your body can cause constipation very early in your pregnancy. To prevent this, you can eat foods that are high in fiber, such as wholemeal breads and cereals, fruit, vegetables, and pulses, such as beans and lentils. Exercise regularly. Not only to keep your muscles toned, exercise actually helps constipation by lowering the time it takes food to move through the large intestine. Drink plenty of liquids. This is very important. Remember that liquids like water and juice add fluid to the colon, making bowel movements softer and easier to pass. If your doctor prescribed iron supplements, which can make you constipated, ask him if you can either manage without them or change to a different type. Now, another one is cramps during pregnancy. A cramp is a sudden sharp pain, usually in your calf muscles or your feet. They're mostly common during the night through the 2nd and 3rd trimesters. The exact cause of left leg cramps during pregnancy isn't clear, but the good news is that you can take steps to prevent them. Steps being the key word here. Take a look at these foot exercises. Bend and stretch your foot vigorously up and down 30 times. Rotate your foot 8 times one way and 8 times the other way. Now, it may help to ease the cramp if you pull your toes hard up towards your ankle. Now, make sure to watch my video on what causes leg cramps during pregnancy. Number 3, fainting in pregnancy. Fainting happens if your brain isn't getting enough blood and therefore not enough oxygen. This can usually happen if you stand up too quickly or if you've been standing for a long period of time, especially in a poor ventilated room. Now, during pregnancy, there are new hormones running the show, like progesterone. This hormone makes everything nice and cozy for the baby, but it lowers our blood pressure, making us feel drowsy and dizzy, and sometimes even faint. So here are some tips to prevent this. If you're lying down, don't get up too quickly. First, sit down for a few moments and then get up. Same if you're sitting down, don't stand up too quickly, and when you do, stay a few seconds standing still before you walk just to make sure you're feeling all right. If you feel you're gonna faint, find a seat or try to lay down if you can. If this doesn't help, lie down on your right side. Every time I'm doing a fetal ultrasound, I always ask the mom if she can tolerate lying down on her back. I do this because many pregnant patients can't lay on their backs for more than a few minutes because they start to feel faint. This is because the baby, placenta, uterus, everything is pressing down on your abdominal aorta, and this sends a message to the brain that your blood pressure is supposedly going up when it's actually normal. Therefore, the brain releases substances in your bloodstream that lower your blood pressure, making you feel nauseous, dizzy, and even faint. You're likely to feel warmer than usual during pregnancy. This is because of those blessed hormones again. They increase your blood supply to the skin, and this makes you feel hot. It also causes you to sweat more than usual. There's nothing new I can tell you on how to prevent this, but I do want you to prevent dehydration. So drink plenty of fluids, water, juice, turn on your AC, and stay under the fan. Now, incontinence during pregnancy, the battle of the bladder. This one can be challenging. It's a very common problem during and after the pregnancy. This is because your new little alien is probably using your bladder as a beanbag chair. You might be unable to prevent a sudden spurt of pee when you cough, laugh, sneeze, or just get up from a sitting position. This may be temporary because the pelvic floor muscles, this means the muscle around your bladder, slightly start to relax to prepare for the baby's delivery. There are exercises you can do to strengthen your pelvic floor muscles. Don't forget to watch my video on exercises in pregnancy. Now, peeing a lot during pregnancy. The never-ending pee adventure of pregnancy. It usually starts in your early stages and sometimes continues until the baby's born. Later on, it's caused by the baby's head pressing on your bladder. Here's an interesting tip. Try to rock back and forth while you're sitting in the toilet. This reduces the pressure of the womb inside the bladder so you can empty it properly. If you have any pain or a burning sensation while you pee, it could be a urinary infection and you could need treatment. This is a reason to call your doctor. Drink plenty of water to reduce the pain and don't take any medication without asking first. Now, skin and hair changes during pregnancy. Now this one's interesting. Did you know that your nipples and the area around them go darker? This usually starts in the beginning of your pregnancy. It's also because of our hormone changes, but to be precise, estrogen and progesterone. These two hormones increase your production of pigment in your skin. That's why your skin color can also get a little darker, either in patches or all over. You might also notice that your birthmarks, moles, and freckles also get darker. You're also going to develop a dark line around the middle of your stomach. This especially happens in the last few weeks of your pregnancy. Now, I know these seem like a lot of changes, but the good news is that they will gradually fade after the baby's born, although your nipples might remain a little darker. If you sunbathe while you're pregnant, try to protect your skin with a high-factor sunscreen and don't stay in the sun for a long period of time. Now, varicose veins. Here's another one of our pregnancy pains, huh? Varicose veins are veins that have become swollen. They're harmless, but they can be uncomfortable. This is usually because of venous insufficiency. As your baby grows, the increasing weight pushes down and places pressure on the veins in your upper leg and lower abdomen. The pressure forces the blood to stay in the legs rather than flowing upward. This is what causes varicose veins. The best way to prevent this, or to make sure it doesn't progress, is to avoid standing for a long period of time. Try not to sit with your legs crossed, and also elevate your legs as often as you can. If it's winter, you can try compression socks, which you can buy at most pharmacies. I only recommend them in winter because they can be pretty uncomfortable during warm temperatures. Now, another good idea is to sleep with your legs higher than the rest of your body. You can use pillows under your ankles. Remember that exercises like walking or swimming helps your circulation and prevent these varicose veins. Try the foot exercises I mentioned earlier. Bend and stretch your feet and rotate your foot one way and the other. Do this with both feet, and the muscle contractions from your calves will help the blood flow. So that's all we have for today. I hope this was information that you find useful. I'm Dr. Carolina Melgar from Sono Health. So if you have any questions, just feel free to drop them in the comments below. Thank you for watching.